Excellent. Let's leave them in listen only mode for a couple minutes.
Should we close the door?
We shall, yeah. I'm going to step out for 1 minute.
I'll let you together, close the door, so I never can.
Have you started making any calls yet?
Not yet. David just brought 4,000 postcards, which is a little terrifying.
Who just brought?
David just printed 4,000 postcards. And we have the list. And it's like 3/4 of people have a phone number, but 1/4 of them don't. So I guess that's what we go through first. Then I don't know. I can't really talk today. I had some dental surgery yesterday, but maybe tomorrow.
Yikes.
I have new toothbone.
Really? I didn't know that was a thing.
Neither did I.
Huh.
But I feel like everything's a little chaotic, but just calling people is the first step to getting it done and making it real. You know, I didn't talk about it for so long.
I walked out of the bathroom and lying straight toward their meeting. It was like, ooh, that's not ours. 17 people.
How many do you usually have?
Are we on mute?
Good morning, everyone. Thanks for joining us for the August monthly meeting. We're going to give the rest of the network maybe about 2 or 3 more minutes to finish. 2 more minutes to finish joining us. And we will be right back with you. Good morning, everyone. Thanks for holding, and the rest of you that joined us, thanks for joining us for August monthly meeting. Today, we're going to have our usual case review for the first half of the 2-hour meeting, and then we'll have a guest from Medicare Rights Center at 11 o'clock. As you may know, we're going to have our case review and discuss any issues, any progress, or any ideas that we want to share. And Patrick also has some updates that he wants to share before we begin.
Yeah, so let's do that now before we begin. I see several names that I don't recognize. I assume you're part of the CHOD network. I just want to forewarn you that for the next hour, we're going to be doing FE ABD things and discussing our programs. So if you want to jump off or mute us until 11, that's when the webinar on the Part A buy-in will start at 11 a.m. That's when Giovanni will be here. So just want to give you that heads up so you can either jump off or just mute it if you want. So first, as many of you saw, I sent out an update with the links to the trainings, the first one being for the FE, the second one being for the lead agency. I was told by DOH that we all have to watch, all the FEs, everybody's got to watch the lead agency one also. Just when you watch that, keep in mind that it is for us. It is geared towards us, that second training. You do have to take a Survey Monkey to register that you've watched that, so please do that. And then once everybody on your team has watched that, please let me know, or at least give me an update on who has watched both trainings, just so I can confirm with our contract manager and let them know, because we had all watched them here and they had no idea. So I had to send them an update of the fact that we had all in the list of who had watched it here, even though I had done the Survey Monkeys and we had registered for that first one. So please just send me a list of everyone who's watched it and when they watched it, and take that Survey Monkey. If you have any questions, feel free to ask now if you've already watched it, or just send any of us an email or all of us an email about it. Like I said, just keep in mind that second one is geared towards us. A lot of those tasks, pretty much all those tasks, will be done by us here at CSS. So that's that. We've had some of you have set up calls with the DSS offices. Please, if you haven't, get on this as soon as you can, because we have received the list from DOH. Adri will be calling people soon. And at this point, I think we're going to go county by county as we talk to these individuals. It is an extensive list. It is long. There's a lot of people on it. And the DSSs really have no idea at this point. I spoke to our contract manager yesterday. She thought they knew, but they didn't. We've spoken to 4 at this point. Every single one of them had no clue. They were aware of the ADM and that these letters had gone out, but no clue that we were a part of this program. So it is quite important, since there is a new transmittal, and we will be starting to submit this proof both from here and locally through you, that you make these meetings as soon as possible. One meeting we did have, which was really successful and I think really beneficial for all of us, was a meeting with the Social Security office. That was with one of sales Social Security offices, and that was really good, really insightful, and it was great to make that connection. We now have somebody there that we can reach out to, not for specific case information, but for general information, technical assistance, etc. So that's super helpful, and I really strongly encourage almost that everybody try to find out what their Social Security offices are in their area and try to make that appointment. The best person to probably reach out to is the office manager or the head of the office, one of the two. That can go a long way in helping this program. So please try to do that. And then finally, the Salesforce licenses. I think I have everybody. I think everybody I've activated everybody's account. If you're having any issues, let me know. But at this point, I haven't heard from anybody, so everybody should be good from my understanding. If you did not get a Salesforce license, you need a Salesforce license, or you're having trouble activating your account, let myself or Carlos or Charity know, and then we can work on fixing that for you. All right, I think that's it. And next week, Charity and I will be up in Binghamton training 3 new hires there. So we will be checking our emails, but will not be in the office. So if you need an immediate response, contact Carlos or Adri. If it can wait, you can just email me. I will be checking my email, and so will Charity. So just be mindful of that. We will be in Binghamton, and I think that's it. Anything else from my review? All right.
All right. So let's begin. We'll start off with ILCHV, and ACR will follow. Anyone from ILCHV?
Okay, I see that LCHV, you typed in some questions, but, oh, there we go. I see a hand now. Okay, Erin.
Good morning, Erin.
Can you hear
You
me?
are unmuted. Yes, ma'am.
Good morning, everybody.
Morning.
Good morning.
So everything is going great at the ILCHV. We are rocking it out with outreach. Chris and Mel have attended a few events, getting the word out there about us, and in return, we've gotten several, if not tons, of referrals. So me and Chris have been quite busy. So that's really it as far as what we have going on. We did have amazing feedback from a woman from the Eddie VNA who gives us a pretty good chunk of referrals when she needs things done for Medicaid. She called following up about one person, and coincidentally, we had already been out there. We knocked out the application, and she said, and I quote, "You guys are amazing, and any Medicaid referral I have, I'm going to bat it your way." So that was our major success for the month. But I can't think of anything else, guys. Are we missing anything? So that's pretty much it for what we have going on over here at the ILCHB.
All right. Thank you, Erin. Question for you. Any issues, any situations or cases that you might want to share?
Do we have any issues, guys? No, a lot of the stuff that if we've had any questions, I know we've had an issue or a question that came up about charity donations and things like that, which I've already touched base with Charity and Patrick about. So we ended up getting that answer back to the social worker, but that's the only real major issue we've had at the moment, and we've overcome it.
Okay, all right. Cool. Thank you, Erin.
You're welcome.
All right, now moving on to ACR, and HCDI will follow. ACR. Emily, I see you have your hand raised, and you are now unmuted. Good morning, Emily.
Good morning. How's everybody?
Doing all right, thank you.
Good. Okay. Both of my FEs are at DSSs today, so it's just me reporting today. I do have two quick updates. You know, we just spoke 2 days ago on our conference call, so that's pretty much still going. My update today is that I finally got a call back from one of our struggling DSSs that lacks contact. So I'm really excited about that. So hopefully they can join us for our site visit. So that was a godsend this morning. That made me very happy. One of our counties that we are working on getting numbers for, I found out yesterday that we have 3 scheduled appointments next week for that county, which is wonderful. So things are starting to look more positive for the month of August. So that's good.
All right, great.
I'm really excited. I don't really have any specific questions for anybody right now. And in terms of cases, again, both of my FEs are on site at DSS today, so hopefully they're getting a few walk-ins and referrals there. I think one of our strategies going forward is, again, to obtain more in-person meetings with our contacts at OFA as well as DSS. So we're going to start to plan and coordinate that as well for applications.
Okay. Emily, any new outreach methods that you've incorporated that was able to help you with this county that ACO was struggling with?
Nothing specific, again, not since we last spoke, but that county, which again is very rural, I went to the DSS and spoke to one of the front desk workers who agreed to help pass out our information again. And, you know, I had said we've been there before, we are again. And again, a lot of it is just local places, pharmacies, restaurants, banks, libraries, things like that, where most of these towns in this county, the population is very low. So I think just going to the source of their regular routine on their daily routine as, just start from the grassroots initiative. So we're still kind of working to get that outreach plan more specific, but that's pretty much what we've been doing. As many community events, such as, there's a farmers market in Utica, there's a farmers market down here in Syracuse, as well as the partnership meetings that we have at Center for Community Alternatives, and I forget the name of the group that Patrice just joined, but she attends that on a monthly basis. It's on the tip of my tongue, but I can't think of it right now. I apologize. But yeah, that's pretty much.
So great. So that's a pretty different approach as opposed to reaching out to hospitals, nursing homes,
well, we're still
DSSs,
doing
other big organizations.
Right.
Reaching out to the mom and pop shops is a pretty new approach for you guys.
Yeah, I mean, we're still going to continue our relationships with what we can with nursing homes as well as hospitals and, the DSSs. But for that one county, specifically Cayuga, I think going to the bottom is where we should start as well, just to kind of rebuild it.
Yeah. Okay. So one of the things to highlight about this outreach effort is that in rural counties, it might be more helpful to reach out to the mom and pop shop businesses and organizations as opposed to the bigger groups like the DSS offices and of them and stuff. Maybe the people in those communities have closer ties to the mom and pop shops than to the hospitals and the DSS offices.
Right. Yeah, right. That's kind of what I meant when I, had said the smaller community-based locations like the libraries and the banks, like the local restaurants and coffee shops that people go to. Yeah.
Great.
Generally.
Emily, could you elaborate a little on the OFA topic?
I'm going to schedule a meeting with our contact at Onondaga OFA. She's been working with us for the past couple of years. She continually sends us referrals, and we always have questions for her when a client might need a Medicare Advantage plan and such and such. So we're going to just schedule a casual meeting once again and see if there's any staff that she has in the office that aren't aware of the ABD program, and if she has any current clients that might have gotten lost or lost a follow-up that we can assist with. To get very busy, and we want to do it soon before Medicare open enrollment starts.
Okay, great. All right. Emily, thank you so much for that update.
Sure, thank you. You're welcome.
All right, so moving on to HCDI and CCSI will follow. All right, Nicole, you are now unmuted. Good morning, Nicole.
Good morning.
Hi there.
So we've been busy with appointments. I was able to get one of our counties, Schenectady, the social services, to hand out our postcards. So I have seen an increase in referrals in that county. I want to try to see if I can get our other two counties that are a little bit slower to see if maybe they can do that. And we're working on setting up our meetings with Social Security and our DSS offices. We do have a big population of clients that don't have Medicare because of immigration. So one thing that Kathy and I have run into is that, and we mentioned this on the call with you, Patrick, is that if we don't check that we're applying for Medicare and Social Security, and we're just applying for Medicare, that we're running into, we get an error that the application can't be completed and that the person needs to either go in person or schedule an appointment with Social Security. So
right, yeah, that's because they don't have the enough working quarters.
Right.
To apply online.
But it seems like it lets us go through if we put that we're applying for both Social Security and Medicare, but I know that you said we shouldn't be applying for Social Security, so.
Right, yeah, that's outside of the scope of our work, so we really shouldn't be helping them apply for Social Security benefits.
Right.
But at that point, they're gonna either have to apply over the phone or go into the office.
Yeah. That's pretty much it. I know you mentioned the Salesforce licenses. Naomi did get her login, but when we tried to go in and show her how to upload an application, hers looks completely different from ours. So I'm going to have her reach out to you because I don't know if I'm not sure what's going on with her Salesforce.
So I'm guessing, because this happened to a lot of people when we first launched Salesforce, is it probably launched as Salesforce Classic, which is the older version. So
okay.
in the top right-hand part of the screen, I believe if you just click on your name, it will give you an option to switch to the Lightning version.
I thought I tried that and I didn't see Lightning version on there, but I can look again with her.
Okay, if it's not there, then it's in that little widget, kind of thing.
Okay. That's about it. I don't really have anything else.
All right. If you can't find it, just let me know, and I can definitely walk her through that.
Okay. Thank you.
You're welcome.
All right, and we are going to move on to, actually,
one more question. Yes, Naomi wants to.
Okay.
Hi, Naomi.
No, it's Allie.
Oh, it's Allie. Comes up as
That's
Naomi.
okay. So I just had a question about that data collection form. I took that webinar that we had to take. Now, will that come with our first list, or how do we get that, or what's going on with that?
Yeah, so this goes to what I was talking about earlier. That second training is created or directed towards the lead agencies. They advise me, though, that all the FEs have to watch it. So that's going to be our role in this. We receive the list. Adri will be reaching out to those people on the list. For those who would prefer in-person assistance, we will refer them to you. So in Albany,
and then will we get a copy of that form to track it of what we do for you, and then have to submit it back to you, or we won't ever have to worry about that?
So it's all gonna be done through Salesforce. That's the plan.
Okay.
I will know this afternoon. I will have a timeline this afternoon as of to when that will be done in Salesforce, and that there will be the Medicare option. It's not there yet. Until that point, what I've been telling everybody to do is to either create an Excel table or something along those lines and track who they have been helping so they can enter that stuff into Salesforce. I can definitely give you or forward to everybody a redacted version of the list with just the column headers. And yeah, I can do that. And then this way, maybe you all can use that to track it for now until we get until Salesforce gets up and running. Yeah, I'll do that, and I'll send that out this afternoon.
All right, that sounds great. Thanks so much.
You're welcome.
All right, and let's move on to Faye. Faye will follow. So CCSI will skip. CCSI actually wasn't able to attend due to a last minute and important meeting.
Yeah, with the DSS office.
With a hard to reach DSS office. So sorry for springing this on you, Faye, but you're up, and Sale will follow. Anyone from Faye?
Or if you want, anybody from Sal, and we can come back to Say when they are ready. One of the two would be good.
All right, Lana, you are now unmuted. Good morning, Lana.
Hi, everybody. How's everyone doing today?
Doing all right. Thank you. How are you?
I'm good, thank you. So I just had something exciting happen yesterday. Fidelis representative contacted me, and she does the Medicare in my town here that Steuben County. And they can't do the ABD, they can only do the MSP and the Advantage plan. So she's going to refer everyone to me that needs to be Medicaid application. And I informed her that we were able to do the Medicare applications and such now and be the helper or whatever. And she's going to start referring them to me as well instead of Social Security. So I was pretty excited about that.
Oh, Lana, did she say why? Just wondering what other organizations we might be able to reach out to that are in similar situations.
No, nope. Actually, we are going to have lunch one day next week, and we're going to go over. It was a quick phone call. She had to go, but we're gonna meet up next week, and hopefully I can get some more information. And I think it's good for me to meet with Fidelis. I've had some problems with them as a navigator, so I'm kind of excited about this new leaf, I guess.
Okay, all right.
That's really all that I have. I just was excited that she actually reached out to me and wanted to give me referrals.
Okay, great. Thank you. Any interesting cases that you want to share?
No, not at the moment. I was kind of slow in July. I'm starting to pick up some more in August, but I don't really have any interesting cases. I've just been plugging along.
Okay, all right.
That's all I have for today. I hope everyone has a great day.
Thank you, Lana. Thanks for sharing that.
Thank you.
All right, and now moving on to sale. I see we have Shirley. You are now unmuted. Morning, Shirley.
Good morning. How are you?
All right. Thank you.
I am here. Everybody signed in under my computer today, but we're all meeting together. So basically, we have this past week met with our local LDSSs regarding the Medicare enrollment. Patrick, I had a question. Are you going to be talking about the CMS 40B form today, or will that be later?
I did not plan on it. We can certainly talk about it. Yeah.
Okay. Well, as we found out with Social Security, if a person is already enrolled in Medicare Part A, but not in Part B, there's an actual paper form. It's called CMS 40B that has to be filled out and signed by the consumer and then actually brought to Social Security. So that is the one and only time that you will not get an actual receipt. But according to the DSSs we have spoken with so far, they will accept on our transmittal form that we assisted the individual to complete it and submit it to Social Security. So that might be one of the questions you want to ask each of your LDSSs when you're meeting with them.
Yeah, and the Social Security offices too, just to discuss that form with them. That's a good point, yeah.
Yeah. Other than that, we don't have anything new, other than this whole week you'll be busy with meeting with social services, and we met with Social Security as well. So
yes.
I guess it's a bit short.
And we have more coming up. So.
Yes, we'll have one today and one tomorrow.
Absolutely. Okay, great. Thank you, Shirley.
All right, thank you.
All right, and that's it for sale. We are moving on to WDOM, and STIC will follow. Anyone at WDOM? Lizette? You're now unmuted. Good morning.
Hi, good morning. How are you guys?
Doing all right. Thank you.
So all has been going good. We did an outreach at White Plains Hospital last month, and they were very happy with our presentation. We were invited through one of the medical representatives, and it was through one of my colleagues. She had a presentation there, so I went along with her. That went well. They had a lot of questions, and we are in touch with them for some referrals. We are doing good with the people that we're talking to. We surpassed our numbers for last month. But one of the questions that I have is pertaining to the Cicatelli webinar. I have not been able to do that webinar. I signed up, but when I was waiting to receive my confirmation email from them so I could do the webinar, I was unable to do so. Just this morning, as some of the other members were talking, I received an email from the LMS support, and they're trying to see what went wrong in order for me to take part of the presentation. I also had one of the new hires here as well. He had a little problem with that, so I'm trying to get some feedback on that.
So you created an online, I think you have to creating an online account with them first?
Yeah, you have to create like your username and then your password, and then they're supposed to somehow email you a confirmation link into the email,
right.
But they haven't done so, not for me or for Robert. And I know Robert was trying to reach out to you guys yesterday.
Yeah, so the first question I asked, but I didn't get a response, was one of the questions I asked, did you check your junk mail folder? Sometimes those go to that by accident.
I did, but what happened is that this morning when the LMS support wrote back to me, he said to me that I checked the logs, but there were no users with your name or email address. So from what I created, he didn't see that.
Okay. And what was the support?
It says LMS support, and then it comes from LMS _support at caiglobal.org.
Yeah, I have no idea. And actually, that link when I got the link, when I click on the link, it goes directly. I don't even have to log in. I don't understand why. But when I look back at my emails, when I received that confirmation email, when I clicked on the link, it wasn't. Like right now, it just goes straight to my account and it opens up. I didn't save the password or anything like that either. So I'm not exactly sure how that works.
So after the meeting, well, that's one of the things that he also asked me in the email, which URL address were you provided? And so I just copied and pasted the URL address that was provided to me. So maybe something is missing, maybe a letter, maybe an underscore. So after this session, can maybe you, Patrick, send me the URL via email? That I could try it again?
You mean the URL that was sent to my, as the confirmation email?
Yes. In order for me to do the webinar.
Yeah, I can send it to you. You can see if it works.
Okay.
The problem with that is, and this goes to why I've been asking all of you to send me who's watched it. So, for example, here we watched it together, and we only signed in under one account, and they only had record of one of us watching it, and so that's why I keep asking you all to send me a list of who's watched what and when they've watched it, because I had to send to them who here watched it, that we all watched it together, who was present, etc., because they responded to me and said nobody here watched it except for this one person who had registered for it. So the issue is if I send you
Mhm.
The issue is if I send you my confirmation link, it's just going to look as if I watched it again.
Got you.
So
Okay.
you need to have you register for it.
But
look,
that's what I thought I did when I did register for it. And Robert as well. That's what he did. He registered. He put in all his information as I did. But I think, I don't know, like he did not get that confirmation email. I did not get that, and I just did mine this morning when I came into the office. So it's still brand new. Robert did his yesterday. He's out of the office today, but for me, that I did it early this morning, I still have not received a confirmation email. So I called the 212 number. There was no response, so that's why I wrote to the support team. I had like I said, the guy, he did answer back, but now I'm just sitting here waiting to see what URL he's going to provide to me. And maybe he will provide one to me, like you said, that was provided to you, and that way I could just go in.
Yeah, the URL is to my account, and I probably signed in the beginning when I first got that URL. Now it's just automatically doing it for me.
Okay.
I would assume. I don't know. It's kind of the whole thing is not far from perfect, because when I try to sign in, actually physically sign in with the username and password that I created, it doesn't let me go. I can't access it. Does that happen to either of you, Adria or Carl? Okay. Yeah, right. I can't actually sign into an account for some reason. But when I click on the link in the email that I received, it takes me directly to the webinars.
Yeah, so when I click on the link, it takes me directly to the page, and I put in the username that I signed up with and the password that I try to log in with, but it won't allow me to access any further. So that's why I was thinking, well, I just wait on the confirmation email, but they haven't sent me anything yet.
I would try to use a different browser to register again.
Okay.
I would try to register all over again, and I would try to use the browser, because sometimes these things are just not compatible with certain browsers, or sometimes like the cache on your internet browser is full or something like that, and you'll need to clear it, which I can't go through the steps here on. But it may be just like a browser issue that it's not letting you it's not actually sending that info to CAI, like it's not doing it for some reason. So I suggest trying it from different browsers.
Okay.
And if there's somebody who's fairly technically savvy there, see if they can clear the cache on whatever browser you're using. This way it gets rid of everything, and it might send it that way. I would try those two things, and then if you keep having problems with it, like if you can't access it before the end of the day or they don't get back to you, just let me know, and then we can help you work on that. All right?
Okay, thank you.
You're welcome. Is there anything else?
No, that's all. Thank you.
Good. All right, thank you.
All right, now we move on to our friends at STIC. Chad, you are unmuted. Good morning, Chad.
Good morning, everyone. I'm going to say a few words, and then Joy is going to jump on if that's okay.
Yeah.
We do indeed have 3 new people that you're coming to train next week. We are looking forward to that. I did my best to embarrass them at our staff meeting this morning, and I will introduce them verbally. Obviously, we don't have video conferencing here. We have Matthew Requa, who is going to be our community outreach and community engagement specialist. We have Brittany Carey, who is going to be an enroller. And we also have Teresa Kircher, who is in our Cortland office, and she is an enroller as well. As far as what is going on here, we've got a couple people at the Shenango County Fair today. So we're doing the typical things that I think most people are doing with at least in the rural areas. I know some places downstate probably don't have a lot of county fairs and things like that, but we're making the rounds in those places and trying to maintain visibility in the community when it's not pouring rain. And things aside from that are going pretty well. I mean, there are, hiring some new people is always challenging, but the new people that we've chose seem to be very bright and they're picking things up quickly, and we look forward to getting them trained and operational. Aside from that, I think I'm going to turn it over to Joy unless you guys have specific questions for me.
No questions here. Welcome to your new staff.
Yay!
All right. Yeah, we don't have any questions. We look forward to coming out there and training. Hopefully this is the last 3. No, I love coming out and training all of you. It's just been months. It's like I'm going into like the 6 months of training at this point. So I have that binder memorized backwards and forwards. All right. So Chad, you said to call on Joy at this point. You're done? All right.
All right. Joy, you are now unmuted. Good morning.
Good morning. I have a question about assets that probably everybody knows the answer to, but I just want to go over it and make sure that I'm giving the answer to this guy, the correct answer to this gentleman. He is the son of someone who is looking at nursing home care, and they have vehicles and savings accounts, and he put everything in both their names a while back. So everything, the titles to the vehicles, the accounts all have his name on them also. So it looks like that he's half owner. So his question is, when they look at the value of the vehicle, they're looking at, regardless of the fact that he owns half of that, they're assigning the value to his mother at 100%, correct? You know what I mean?
Well,
like what they're
so
looking
the first
at.
vehicle, right, but the first vehicle is exempt. So,
okay. But like I said, I think there's like 3 vehicles involved that are all in both his name and his name. And all the savings. And so his question is,
anything?
What's that?
Are they worth anything?
I'm
not trying to be.
I think 2 are vehicles and one is a motor home, like a motor home, not a mobile home, a motor home.
Okay. So, how old are they?
I don't.
Are they like really old?
No. I think they're going to be worth something. I mean, I think at the end when we total up all the vehicles, I mean, I told him his best bet is to take them out of his name or her name, right?
Well, then you're going to probably encounter a transfer penalty, especially for the motorhome.
Yeah.
Because if it's worth a significant amount of money, and they're looking to go into a nursing home, you're gonna, then you're probably looking at a transfer penalty. It's gonna count. That motorhome's gonna count.
Yeah.
In resources because.
But it's going to count at I guess this is what he's asking. Is it going to count at the full cost of that motorhome or at half of it because he has half ownership?
Cost, whatever the fair market value is.
Okay. All right.
Unless there's some, I mean, is it just they just own it together, right? Like
Yes.
The son is, there's no like, I mean, it's going to be 100% unless there's like an impediment to the mother in selling it, but like it doesn't sound like they just own it together.
Yes, everything.
Unless,
like everything we talked about, it's both their names.
And she bought it, right?
Oh, they bought it. That's the thing. I don't know who invested the money, if they actually went 50-50. you know, that's the same thing like he's asking about the savings account. Okay, so they've got like 6,000 in a savings account in both their names. If he takes 3,000 out, they're going to ask about that, right? Even though that's his share.
Yeah, they're going to have to explain it. Otherwise, there's probably, they could impose a transfer penalty on that too.
Yeah, as long as his name is on it, they're gonna treat it as if it's his.
Yeah.
You mean
like
hers?
Hers, right?
Yeah.
Right, but unless they can prove that $6,000 is all the son's, or the mobile home was purchased by the son with his money, and they put the mother on it so she could use it or something like that, or like if they prove for whatever reason, like if they can prove that it's with, but then they're going to make the son make the applicant take her name off of those accounts in those vehicles. It's a risk.
But at this point, it's going to show that transfer of the money, right? Taking it out of her name and putting it in his, they're still going to look at the transfer, correct?
Right. So right now they're going to count it as hers. It's available to her. With her name on it, it's available. Like those assets are available. In other words, she could liquefy them and use that money for whatever. Right?
Yeah, in his eyes, though, what he's looking at is no, she can't. She can only liquidate 50% of that because the other half is his. But that the bank would let her go and take 100% out, right? So that's kind of why he doesn't technically own 50%. It's like a trying to
exactly.
Half of it's mine.
Yeah, I know that. Yeah, in theory and in their minds it is, but in terms of what we're talking about, and in terms of the bank, like she can go in there, take that $6,000 out, and it's all hers, and he's got nothing to say about it. So that's why if he can prove that it is all his, that $6,000, just to focus on that one, and it's all his, and they can prove it, it's like not like it would have to be that he deposited that $6,000 and that it came from one of his accounts. Then if you're lucky, if they agree, what they'll say, okay, fine, take it all out and take the mother's name off of the account, or either take the mother's name off the account or son take all the money out.
Okay.
And therefore she's got a zero balance. But they're going to have to prove it and satisfy the questions of the DSS office.
Okay.
And it's kind of it's the same things when you're going to that RV. Or
if he bought it with his money, then just take her name off. But.
Right, but take the name off of it if the DSS tells you. Like right now, as is, if they go and if he goes and takes his name off of it, and you provide all the documents for the 5-year look back, they're going to ask where these things went.
Right.
And they may look at it, and especially an RV, as though she transferred those assets in order to qualify for Medicaid and qualify for the nursing home Medicaid. Like that's what they're going. That's what they're going to see. That's in my eyes right now. That's what it is. Like that's what they would be doing. So that would be really hard to disprove if they do it now. So to go to the DSS to provide with the application those things, and they're going to have to prove it. It's not just a letter. Like he can't just write a letter saying, "Oh, I bought this RV with my money," or "I deposited this money in the account." Yeah, that letter will have to come, but then he will also have to provide the documents of where that $6,000 came from and that he deposited it.
Yeah.
Like,
Okay.
there will have to be like physical evidence that he did this and that it is his, or that RV was purchased outright from his funds. It can't. It's not. They're not gonna take. And I'm assuming you're talking about Tompkins County, correct?
Yep.
Yeah. So I mean, my assumption right there is that there's no way they're just gonna take a letter. I mean, almost all DSS, I doubt any DSS would, claiming that, oh, I bought this RV with all of my money, and my mom, I just put my mom's name on it just because.
Yeah.
Like, I mean, maybe, I mean, if like he couldn't afford an RV and wanted to buy an RV for his family and needed her to co-sign the loan or something.
Yeah, I think that this was a case where they kind of thought it would be good to put to get everything
right
in the mother's name, so they put it half in his name. But yeah, like I said,
right,
as
right.
I was explaining it, I mean, I was pretty sure I knew the answer to it, but then, he started talking about I own 50%. I just wanted to clarify, but that's good that I can tell him that he may be able to, if he can actually prove it.
Yeah, I mean, if he can prove that it's his and he paid for everything outright, but that's not even foolproof. It is totally in the DSS's discretion. So please, if you do advise, not advise, I shouldn't use the word advise. If you do inform him of these rules or of this, please make sure he's aware that this is not like a foolproof plan or this is like 100%.
Okay.
It is still within the DSS's discretion to impose a transfer penalty.
Okay.
Like, it's just a matter if they agree with what he's provided. So they can try it, but I don't know. And, also, as you well know, remind him that you are not making the decision, and even though you're telling him these rules and these things, you're not making the decision, you're not doing the budgeting, especially the nursing home budgeting.
Yeah.
But these are the things. So, but does she have that $6,000, does she have any more money?
Yes. She's got her
A
own
lot?
account. Yeah.
Is it a significant amount, the other account?
What's that?
Is the other account a significant amount?
It's almost the same amount. I think it's $7 something. It's about less than $1,000 more than the one that's in both their names. But he's going to take that one and get a prepaid, an irrevocable prepaid funeral account with that money. He's already decided that they already talked about. So
she'd be under resourced anyway. I mean, in terms of the bank account. I mean, that bank account's not worth over $14,000. I mean, the combined the two are not worth over $14,000.
Yeah, I don't think they are now. I think they were. I think that's why he was asking all the questions about how to spend it down. Can he buy a car? What if the car that he's got is in both their names, or it is in both their names, and the RV?
Oh, it sounds.
Yeah.
Wait, there was more. Now there's not. Now there's less.
What's that? No, yeah, they did have some. I'm not sure what they bought with it, but it was.
Oh my gosh.
And there's two other brothers also came in and sat down with me, and they were like just hammering me with these questions. I'm like, wait a minute.
Yeah,
and I think they're just trying. They are looking out for her best interest. I just think they've made some poor decisions in the past that probably have made things worse.
Yeah, well, it sounds like the recent past, and it sounds, I mean, based on what you're saying, it sounds like they went and purchased things with that money to get under the Medicaid limit, unfortunately. Like, if she had more resources, that's what it's starting to sound like. So, I mean, the best they can do is try to explain that and provide evidence of that they were the full owners. They just, for whatever reason, put it in their name, et cetera. Hope, like I said before, and hope that DSS agrees with them, but I mean, it certainly sounds like there's going to be some form of transfer penalty at this point.
Yeah, yeah. All right, I will get back in touch with him and let him know what you said.
Okay, sounds good.
All right.
Anything else, Joy?
No, I just an observation. I don't know if other people are noticing this, but the 4 out of the last 5 ABDs I did, I didn't even work with the client. I worked with the children. They had the power of attorney. They had everything. It's like, I guess that just seems like there's more and more where I'm not even dealing with the client. I'm dealing with the children.
Interesting.
So,
yeah, I don't know that.
But
Sorry.
I just, too, when you're talking about outreach, that might be something to think about. A lot of times you've got, you really don't want to be, we definitely have to target the people that are looking and need the ABD applications. But like I said, there seems to be so many that are getting the assistance from their family members that, targeting that generation.
Yeah, that's a good point. Absolutely. Not sure if anybody's really thought of that. I really haven't. It's a good idea though.
Mm-hmm. And like I said, maybe even with the saying, do you have parents that need help?
Yeah.
But
I like that. I don't know that we've really done that or focused on that, but reaching out to the children.
Mm-hmm. The ones that are helping, the ones that are. And, I guess that goes to the other thing I say. I think Emily was talking about the different means, especially in rural areas, of doing that outreach. And, I think hospital systems, nursing homes, doctors' offices, those are great, but then we're hitting the people that are already in need. And I think that, by going into the libraries and the post office and the laundromats and those places, you're going to get the people before they need the help. So they're not waiting until they're sick and going. We get them enrolled earlier, that we might be able to get more preventive services, and they wouldn't end up in the nursing homes or the hospitals.
Right.
Just an observation.
I think that's a good point. No, it's a great observation. I think it's a good point. We don't necessarily all think about that. Like I said, I didn't really think about targeting that audience. So I think that's a good idea. And we should look into more ways to try to do that. For sure. So, all right. So, Joy, it's 11 o'clock, so we're going to start the webinar now. I don't mean to cut you off.
Okay, no, I'm done. Thank you.
All right, thank you.
Bye-bye.
So just everybody give us a minute or two to set up, and we will be right back with Giovanni and Medicare Part A buy-in presentation.
Hi, everybody. It's Gio Flores here, CSS. Thanks, everyone, for joining us. And today we're going to be doing a training on the Medicare Part A buy-in, a rather complex process, but hopefully we'll be able to go over the details of the buy-in through this 1-hour training. Thank you for joining us. So most of you know who we are, the Medicare Rights Center. We are a national nonprofit consumer service organization, and we work to ensure access to affordable health care for older adults and individuals on disability, aka the Medicare population. We do this in 3 ways: through counseling and advocacy. We do have a national helpline where Medicare beneficiaries, or professionals, providers, caregivers can call us across the country with any Medicare questions that they may have. We provide educational programs and trainings to community and to professionals such as yourselves. And then everything that we gather and we learn drives our public policy initiatives at both the federal and the state level. So today we're going to go through the Part A buy-in. First, we're going to cover some background information about some agencies and the benefits that those agencies administer, and the agencies that are involved in the Part A buy-in. We're also going to talk about Medicaid eligibility, and this is disabled age blind Medicaid, otherwise known as district level Medicaid. At the core of our training is going to be the Part A buy-in, and then we're going to talk about some troubleshooting, because the Part A buy-in, as I mentioned before, is rather complex. So even if it is done, even if it is processed, you know, there may be still some issues that may arise. So we're going to talk about some troubleshooting issues and how to resolve those issues. And then we're going to end the training with some case studies. So the federal agencies that are involved in the Part A buy-in is, first and foremost, is the Social Security Administration. So Social Security is really the only agency within the federal government that can provide Medicare entitlement, meaning that they can enroll somebody into Medicare, Part A or Part B or both. They also enroll individuals into the Extra Help Program, which many of you may know is the Federal Prescription Drug Assistance Program. Additionally, they also administer cash benefits such as Social Security Retirement, Social Security Disability, and Supplemental Security Income. The Program Operations Manual System, also known as the POM, is the manual that is distributed to local Social Security field offices, and this is the manual that field office representatives utilize to process and you know, the various benefits that Social Security handles. The Centers for Medicare and Medicaid Services, CMS, you know, we often refer to CMS as Medicare itself. So once somebody is entitled to Medicare, and somebody obtains entitlement through Social Security, so once they're in Medicare, in the Medicare program, CMS is the one that administers the Medicare coverage. They also administer Medicaid and other programs. At the state level, the New York State Department of Health, they're responsible for New York State Public Health. They oversee the New York State Medicaid program, which includes the Medicare Savings Program, and they also participate in the data transfer for the Part A buy-in. The Medicaid offices, also known as the local departments of social services or the local district, HRA being the ODSS in New York City, they're the extension of the New York State Department of Health, and they've been provided the authority to enroll people into the Medicaid program and the Medicare Savings Program. So as I mentioned before, Social Security administers Social Security retirement benefits. So retirement benefits is a monthly benefit that is based on the payment of Social Security payroll taxes for at least 10 years or 40 working quarters, also known as 40 working credits, you know, whatever you may refer it to. So if somebody does contribute 10 years to the Social Security tax system, they are eligible to collect Social Security retirement benefits. And usually people can begin collecting them at the age of 62, and the full retirement age varies depending upon the date that somebody was born. But essentially, when somebody has that 10 years of work history, they can collect retirement benefits, and the same exact qualifications to collect retirement benefits is also the qualifications to be eligible for Medicare, for free Medicare Part A. So as you all may know, Part A of Medicare is the hospital insurance part of Medicare. So it covers individuals when they're an inpatient at a hospital. And if somebody is collecting retirement benefits, they should be eligible for free Part A, meaning that they don't have to pay a monthly premium for Part A. Now, if somebody has less than 10 years of work history, that means that they can't collect Social Security retirement benefits, and also they are not eligible for free Part A. And when somebody's not eligible for free Part A can become rather expensive. So somebody, by the time they're aged into Medicare, by the time they turn 65, if they don't have 10 years of work history, if they have less than 10 years but more than 7.5 years of work history, the Part A premium on a monthly basis for them is $232 per month. If somebody has less than 7.5 years of work history by the time they turn 65, then the Part A premium for them is $422 a month. Now, keep in mind that not being eligible for free Part A also means that they're not eligible to collect Social Security retirement benefits. So somebody who finds themselves in that scenario doesn't have that retirement benefit, which is the common source of income for individuals in that age group, and at the same time, they're expected to pay $232 per month or $422 per month for Part A. I'm not sure how the federal government really expected them to pay that without collecting any sort of retirement benefits. So Social Security also administers SSI, or Supplemental Security Income. It's a monthly benefit designed to help aged, blind, and disabled individuals with limited or no income. SSI recipients are eligible for any other SSI recipients who are eligible for any other cash benefit must pursue all available forms of income. So you may come across individuals who may only be eligible to collect SSI. So meaning that by the time they're 65, they don't have the work history to collect retirement benefits, but they're eligible for SSI. So, you may come across somebody who gets the federal maximum SSI benefit, which in 2018 for a single person is $750. But you also may come across individuals who are eligible to collect retirement benefits. And there may be a low amount of benefits. And that low amount of benefits also makes them eligible to collect additional SSI. So, for example, somebody who collects $500 of retirement benefits, since the 2018 SSI maximum is $750 for a single person, that person would still be eligible to collect $250 of SSI. So you can come across individuals who are just collecting SSI, or who may also be eligible to collect both SSI and retirement benefits. Either way, if they're collecting even $1 of SSI, they should automatically get Medicaid, because that is as per federal and state regulations, that somebody on SSI should be automatically enrolled in the Medicaid program in New York State. Speaking of Medicaid, this is the ABD or DAB or traditional Medicaid, non-Magi Medicaid, whatever you want to call it, district level Medicaid. It has many different names that you all may be aware of, and I'm sure you're aware of the income and the asset limits. The key thing that I want everybody to take away from this slide is the note at the bottom. As per Section 3662B1 of New York Social Services Law, requires individuals who are eligible for or reasonably appear to meet the criteria of eligibility for benefits under Title 18 of the Social Security Act, which is aka Medicare, to apply for such benefits as a condition of receiving assistance under the Medicaid program. So essentially that's saying that if somebody is eligible for Medicare as a condition of Medicaid eligibility, they should apply for Medicare. Because once you're 65 and older, Medicare should be the primary health insurance coverage for those individuals. Now, this has been a long-standing rule, but for many years, New York State has overlooked that rule. So, you come across clients, I'm sure, in our work who are in their 70s or in their 80s who've had Medicaid for all those years, and they never applied for Medicare. So, unfortunately, recently, New York State has decided to address that oversight. So in October of 2017, they released an ADM, an administrative directive, to provide information and guidance regarding the requirement that certain Medicaid applicants and recipients apply for Medicare as a condition of Medicaid eligibility. So essentially, the state tracked several thousand Medicaid beneficiaries across the state who were 65 and older, therefore were eligible for Medicare, and who didn't have Medicare, and who just had Medicaid. So these thousands of individuals received a notice from New York State, specifically from their local Department of Social Services, informing them that they're eligible for Medicare because they're over the age of 65, and that in order for them to continue their eligibility for Medicaid, they had to apply for Medicare, and that they had to show proof that they applied for Medicare to their local Department of Social Services. So this could be a confirmation statement from the Social Security office that they applied for Medicare. So again, several thousand individuals received this notice. Also going forward, anybody who submits a Medicaid application or Medicaid renewal and who seems to be eligible for Medicare and doesn't have Medicare in the system will also get the same notice. So you're going to get the notice saying that you're eligible for Medicare, so in order for the local district to process the Medicaid application, they have to provide proof that they applied for Medicare. Now you may say, why did all these individuals, thousands of individuals that the state found that had Medicaid for years and never applied for Medicare? Most of these individuals likely didn't qualify to collect Social Security benefits, meaning that they didn't qualify for free Part A. They therefore decided not to enroll into Medicare because they would have to pay a Part A premium and a Part B premium that they may have not been able to afford. Or another scenario could be that they did apply, they did enroll into Part A and to Part B, but because they had to pay both the Part A and the Part B premiums, they may not have been able to keep up with those premiums. So eventually they lost Medicare Part A and Part B due to premium non-payment. So either of those scenarios could be true for a lot of these folks. Since they're not eligible to collect Social Security retirement benefits, that means that they're likely eligible for the Part A buy-in, because to be eligible for the Part A buy-in, a person has to meet the income limits of the Quimby level of the Medicare Savings Program, which we'll talk about the income limits on a later slide. So now we'll jump into the Part A buy-in. I just want to open up for questions, if there are any questions before we jump into the Part A buy-in. Check if they are. Did you check questions here? Here we go.
You want to pop it out next to the X on the right-hand side?
This one? Oh, right. Is there a date yet for the annual meeting in, oh, okay, I'm sorry. Do you have to be 65 or older for the Part A buy-in? Question by Greg. Yes, Greg, you do have to be 65 or older to be eligible for the Part A buy-in. And there's a slide that we're going to talk about the eligibility criteria for the Part A buy-in, which does include being 65 years or older. Okay. Moving on. So again, the Part A buy-in is a process that is available in New York State for individuals who are ineligible to receive premium-free Part A, which means that they don't have the work history, the 10 years of work history by the time they reach the age of 65 for free Part A, and allows the individual to obtain Medicare and the QMB level of the Medicare Savings Program. As you all may know, the QMB level of the Medicare Savings Program is the only level of the MSP that not only pays the Part B premiums, but also pays the Part A premiums. So that's why QMB is such a integral part of the Part A buy-in. So it usually occurs to people who have not worked long enough and who do not qualify to collect Social Security retirement benefits, who have low income. And again, since they're not collecting Social Security retirement benefits, more likely than not, they do have lower income, and who have never enrolled into Medicare when they turn 65. It could also work for individuals who may have enrolled into Medicare by the time they reach 65, but then, as the years pass on, they couldn't keep up with the premiums, so they lost Medicare. So really, if they have no Medicare at all, either Part A or Part B, they can do the Part A buy-in. Social Security will enroll the individual into what's called Medicare Part A on a conditional basis at any time of the year. So it's called conditional because it's based on the condition that the person is found eligible eventually for the QMB level of the Medicare Savings Program, which again pays the Part A and the Part B premiums. That's why it's called conditional Part A. Beneficiary, after applying for conditional Part A and Part B through Social Security, they could then apply for a QMB level of the Medicare Savings Program through their local Department of Social Services. And if they're approved for the QMB program, then QMB will pay their Part A and their Part B premiums. Again, the applicant does not need to have any parts of Medicare in order to do the Part A buy-in. The Part A buy-in is something there that gets them Medicare. So the eligibility criteria are not, too long. So a person will have to be at least 65 years or older in order to do the Part A buy-in. And this is because if somebody is under the age of 65 and they have Medicare, the only way that you could get Medicare if you're under the age of 65 is if you're collecting Social Security disability insurance for 24 consecutive months, which means that they meet the criteria to collect those SSDI checks, which also means that they meet the criteria for free Part A. Therefore, they would have free Part A, and they will have no need to do the Part A buy-in. They also have to be a current U.S. resident and either a U.S. citizen or a lawful U.S. resident having lived in the United States for 5 continuous years before applying for Medicare. They have to be ineligible for free Part A, so by the time they reach their 65th birthday, they have to have less than 10 years of work history, essentially. And they also have to meet the New York QMB eligibility requirements, and the income limits for QMB are right there. It's $1032 for a single person and $1392 for a married couple. There's no asset test for QMB or any level of the Medicare Savings Program, so a person really just has to meet that income threshold. So now that we know how the Part A buy-in, the gist of the Part A buy-in, I do want to make you aware that there are really 2 paths to the Part A buy-in. The first path is for somebody who is not collecting supplemental security income. So a non-SSI recipient who doesn't have any parts of Medicare and wants to do the Part A buy-in to get Medicare on a conditional basis so that they could then apply for the Medicare Savings Program. The other path is a much more streamlined path, and those are for folks who are on SSI, who are 65 years or older, but who don't have any parts of Medicare. So it's much more streamlined for them. We'll talk about how it works for those who are collecting SSI later slide, but for now, let's focus on how the Part A buy-in works for those who are not SSI recipients. So the Part A buy-in starts by applying for Part B and conditional Part A at the local Social Security office. As I mentioned before, Social Security is the only agency within the federal government that can provide Medicare entitlement. So that's why the Part A buy-in always has to start with Social Security. And it's important to get Medicare entitlement because in order to apply for the Medicare Savings Program, given what it's called, Medicare Savings Program, it's a Medicare benefit, meaning that a person has to have some kind of Medicare entitlement in order to apply for QMB at the district level. So if they don't have Medicare entitlement, they're not eligible to apply for QMB yet. So that's why it's important to first start by visiting the Social Security field office, the local field office, and requesting to apply for conditional Part A and Part B. So only Part A is called conditional. There's no such thing as conditional Part B. So when somebody does request to enroll into conditional Part A, they will also get regular Part B. That does mean that they're probably going to start seeing bills for the Part B premiums because the system just doesn't recognize a conditional Part B. But if it's done correctly, they should get conditional Part A, which shouldn't start to generate any bills for Part A. And again, it's conditional because the individual is letting Social Security know that I'm going to eventually apply for the Medicare Savings Program, and I just want this conditional status there so that I have Medicare entitlement so that I am allowed to apply for the Medicare Savings Program. And if I get QMB, QMB will pay the Part A and the Part B premiums. Successful applicants for Part B and conditional Part A should receive a confirmation letter. This is some kind of a printout or statement from the Social Security field office on the same day that they request the Part A buy-in. And that statement pretty much reiterates, why they went to the field office. It confirms that they applied for conditional Part A and Part B. So that confirmation letter can be used to apply for the Medicare Savings Program. Usually when somebody applies for the MSP, they should attach their Medicare card. So a Medicare card will be generated when somebody applies for conditional Part A, but it's not going to be in the mail until 4 weeks out. So, you know, we usually advise people to apply to the Medicare Savings Program as soon as you get that confirmation statement from Social Security. So they can apply for the MSP, and in lieu of their Medicare card, which will be coming in 4 weeks, they can use that confirmation statement to confirm to their local district that they've applied for Medicare. So then the LDSS should screen them for the QIMBY level of the Medicare Savings Program, and once they're approved for QIMBY, QIMBY will start paying their Part A and their Part B premium. So that's pretty much the gist of the Part A buying process. You know, you start with Social Security to get Medicare entitlement, and at the end of the process, you are found eligible for QIMBY, which pays the Part A and the Part B premium. So the materials a person should bring when they visit their local field office to do the Part A buying is that they should bring a proof of date of birth, such as a copy of a birth certificate, proof of all types of income, earned and unearned, you know, pay stubs if they're working on full-time or part-time jobs, pension statements, tax returns. You know, more likely than not, these individuals are not going to be eligible for Social Security benefits because if they are eligible, that means they're eligible for free Part A. And some of them may not even have any income to report. Some may be living with friends or family who provide shelter and food. Usually an attestation letter from that friend or that family member just confirming that this person, you know, lives with that friend or family member and they're being provided shelter and food. That's usually enough, and that's usually sufficient to prove that they're receiving zero income. We would also highly recommend that the individual bring a printout of the POMS operations manual. So this is Social Security's own manual, and it pretty much guides a Social Security representative how to correctly process a Part A buying. So the POMS is publicly available, and we do have a link there, and we would definitely suggest that a person print out those POMS citations and bring it with them to their Social Security field office, because what usually may occur is that when somebody goes to Social Security and requests a Part A buying process, oftentimes Social Security has no idea what they're talking about. They've never heard of the policy. They don't know how to, you know, process that request. So just, you know, printing out their own manual and showing them that this policy actually exists is helpful. We also developed our own Part A buying flyer where we laid out the steps, and this is a consumer-friendly flyer. We've also drafted a letter that a person can bring, and that letter pretty much explains to Social Security why they're there, that they're requesting the Part A buy-in, and also provides the POM citation. So a person really doesn't even have to say anything. They could just hand that letter to the Social Security representative, which explains why they're there and what they want to do. And that link is there as well. So once they do the Part A buying process, if it's correctly done, they should walk out that same day with a confirmation letter from Social Security that they've done the Part A buying, that they have conditional Part A. And then right after they get that, they could apply for the Medicare Savings Program with the local Department of Social Services. When they apply for the MSP, they should provide proof of Medicare enrollment. And again, this could be the Medicare card. If they wait 4 weeks from when they enrolled into conditional Part A, and they'll have the Medicare card in the mail, you know, that's fine if they want to wait. But they could apply without having to wait for that Medicare card and just using that confirmation letter that they get from Social Security. They should also attach a proof of address, copy of the Social Security card, and proof of all forms of income, earned and unearned, with their MSP application. A quick note, individuals who are required to submit proof of Medicare application to their LDSF as a condition of their Medicaid eligibility should be automatically screened for the MSP upon submission of their Medicaid application renewal with their proof of Medicare, application. So this is for folks who are receiving that notice from the RDSS saying that, you know, you submitted a Medicaid application or a Medicaid renewal, but we see that you're 65 and older and that you should apply for Medicare. So please do so and provide us with proof that you've applied for Medicare. So if they're submitting that proof to their RDSS, who already has their Medicaid renewal or their Medicaid application just pending to be processed until they get that proof, once they submit proof, which could be that confirmation letter that they get from Social Security saying that they've enrolled into Conditional Part A, once they submit that proof, the LDSS should continue processing and evaluating their Medicaid renewal or their Medicaid, their new Medicaid application for Medicaid and for the Medicare Savings Program. So that person doesn't have to submit a separate standalone MSP application because the LDSS should screen them for both Medicaid and the MSP just based on the Medicaid application. Now that's per policy. The perennial issue has been that when somebody submits a Medicaid application and they're Medicare eligible, even though the LDSS should screen them for the MSP, they often overlook that part of the process. So they either get only screened for Medicaid and they never get screened for the MSP. So that's why even though policy says that they should be screened for the MSP, we still advise to submit a standalone MSP application just to make it clear that they want to be screened for the MSP as well. So any questions about the more lengthier Part A buying process for non-SSI recipients before we talk about what happens for those who are on SSI?
Is the only way to get it is by physically going to the Social Security, and what happens if you encounter a consumer who they want?
Yeah, no, so Social Security has confirmed to us that they can request a phone interview. What happens is that, they'll schedule a phone interview. Social Security will contact that person and will, ask them all the questions that they need to be asked for the Part A buying process. There are some things that they need in writing, signatures and whatnot that Social Security should mail out to that person, and that person can mail it back. But it can be done over the phone and through mail. Yeah. I mean, we usually, obviously, this is for individuals who are homebound and really have no way of going to the Social Security office, but we definitely always advise if you can go to the field office to do so, because it's complex even to explain it to somebody at Social Security what somebody wants through the Part A buy-in. So I could imagine how difficult it could be over the phone and over the mail.
I have a question.
Sure.
People first enroll into Conditional Part A and they get B.
Yes.
And so you were saying that they have to wait while their MSP application is being processed and they may receive bills for their Part B premiums.
Right.
Do they ever get coverage for that? Because I don't think Quimby goes retro, right?
No, it doesn't go retro. The Quimby effective date will always be the first of the month following the month that the Quimby application is submitted. So it's never going to go retro. But once the Quimby is approved, even if a person has an outstanding Part B bill on the record with Medicare, as long as they have an active Quimby case, Medicare really can't do anything about that outstanding bill. It's just going to stay there. So long as this person gets Quimby and keeps renewing their Quimby, that outstanding bill is just going to be there.
So the advice to consumers would be not to pay their Part B bill.
And again, this is because these consumers are likely not collecting Social Security benefits, have very little income, so we always would advise not to pay the premiums that they're going to be billed for, because Quimby will eventually pay for those. And going forward, if they keep renewing, Quimby will keep paying for that. I just want to see if there's any questions here. I don't think so. All right, so moving on to how the Part A buying should work for those who are receiving supplemental security income. So if somebody is on SSI, and they may have been on SSI prior to becoming 65, and they don't have any work history to be eligible for free Part A, what should happen is that Social Security should actually automatically enroll them into Medicare upon their 65th birthday. And Social Security should also automatically enroll them into Quimby to pay for their Part A and their Part B premiums. Sometimes it doesn't happen though. So sometimes you can come across somebody who's on SSI, they're 69, and they've never been on Medicare, but because they're on SSI, they've had this Medicaid for all those years. So what that person could do is that they could request what's called a public welfare accretion. And this is a process within Social Security's own manual and their own policy. So somebody could go to their Social Security field office, let them know that I'm collecting supplemental security income and I'm also 65 or older, and I would like to be processed for public welfare accretion. And they should bring out the PALM citation for this public welfare accretion process, which we've linked right there. It pretty much explains to the Social Security office that a person who is on SSI and who is Medicare eligible should be enrolled into Medicare and should also be enrolled into QIMBY. And Social Security can actually do both at the same time for SSI recipients. And that's because Social Security has what's called a 1634 agreement with the state of New York, meaning that the Social Security field office or the Social Security regional office can actually make Medicaid determinations for SSI beneficiaries of New York State on behalf of the New York Department of Health. So that's the agreement that Social Security has with the state of New York, meaning that Social Security, on that one visit by that SSI beneficiary, should enroll that person into Medicare and should also turn on QIMBY for that person because they have the authority to do so since that person is an SSI. So that person really doesn't need to go anywhere else. They doesn't need to go to their LDSS to apply for QIMBY because Social Security should do both of those things for that person. That's why it's a lot more streamlined. It's one PALM citation to bring, and if it's correctly done, the person should walk out with Medicare, should wait in the mail for a QIMBY approval notice. Any questions about that?
So this is not done automatically. Once they turn 65 and they collect an SSI, the client will still have to go and request to work?
It should be done automatically, but we have seen many cases where it's not. Yeah, we've seen cases where somebody is 70, has been SSI since they were 65, and just for some reason they fell through the cracks and they would never enroll into Medicare. Yeah, but this should be the quick fix for that. Yeah. Okay, so troubleshooting, and there is a lot of troubleshooting with the party buying. So because the party buying, it's rather complex, and it's rare, and Social Security field offices often don't come across it, don't know how to do it, don't know how to do it correctly, even if they agree to do it. Sometimes it's just best to avoid the party buying process if a person can. And really the only way to avoid the party buying process is if somebody finds themselves in their initial enrollment period for Medicare, meaning that if a client comes to you and they're saying that I'm turning 65 or I just turned 65 last month and I don't have the work history to collect Social Security benefits, then you know that they're within their initial enrollment period, which is that 7-month period that surrounds their 65th birthday month. It starts 3 months prior to their 65th birthday month and 3 months after their 65th birthday month. During that IEP, person could go to Medicare and enroll into, go to Social Security and enroll into Medicare without any issues because the IEP is very straightforward. Social Security knows how to do that without any issues. So once they enroll into Medicare using their IEP, then they could just go to their local Department of Social Services and apply for the Medicare Savings Program. It's a lot easier to do it like this. Again, this is if you find somebody who's within their IEP. If they're outside their IEP, then the party buy-in is really the only route for them because, again, the party buy-in can be requested at any time of the year. But if they are within their IEP, it just makes sense to do it like that. Same thing for those who are on SSI. Even if somebody is on SSI, and you advise them to enroll into Medicare during their IEP because they haven't been automatically enrolled. Once their Medicare starts, then the feed from Social Security should go to the state that this person is now on Medicare and on SSI. So QIMBY should be automatically turned on as soon as they get Medicare. Yes.
If they lose SSI,
do
they still follow that? One of those units.
The Stenson, Rosenberg, yes. I'm not sure they do. Not for QIMBY. I have to confirm that though, but I have seen people, I have not too many, but people who lose SSI, and as soon as they lose SSI, the premiums stop getting paid. I'm not sure if that's how it should be, but I've had 1 or 2 cases where I've seen that. Yeah. Oh yeah. So the question is, if somebody does lose SSI, do they automatically lose Quimby paying for their premiums? I said that I wasn't too sure of it. I have seen some cases where they lose SSI, Quimby stops paying the premiums pretty quickly, but I could confirm if that's what should happen. That's what should happen.
I have a question about applying for MSC in your initial enrollment period. So in my experience, if a client tries to do that, they nearly always send them back to the Social Security Administration, because they're like, you have to come with proof that you have Part A conditional or whatever,
right?
And you don't have it.
Well,
your initial enrollment period.
Right. Well, if they're applying for Medicare during their initial enrollment period, they still have to go to Social Security first.
Okay. Yeah.
Right. So they have to get something from Social Security or the Medicare card first. Yeah.
Okay. Sorry, my eyesight is a little bit weird.
Sure. No problem.
Go to LDSS and.
Right, and this is after. Right. This is after. Yeah. Yeah. Yeah.
Sorry, it's
no problem.
I was like, why are they going there?
Oh yeah, if they go to the ODSS first, they're going to be turned back. Just want to make sure there's no questions. I think there might be. So the question is, if someone applies for Medicare within their IEP, how do we know if the Social Security Office also submitted an MSP application? So the Social Security Office really is not going to do or really has anything to do with the MSP application unless the person is on SSI. So only if the person is on SSI can Social Security do both the Medicare enrollment and also the Quimby enrollment as per that 1634 agreement that Social Security has with New York State. But if somebody is not on SSI and goes to Social Security during their IEP to get enrolled to Medicare, then that's really the length that Social Security is going to go to. It's going to give that person Medicare enrollment, but then that person has to go to their LDSS to apply for the Medicare Savings Program.
Sorry, Chair, I think I'm also confused with everyone else.
Sure.
So what's the benefit when you are within your initial enrollment period? I think we're missing.
Right, so the benefit is that Social Security should be pretty knowledgeable how to do an IEP Medicare enrollment. They're not very knowledgeable how to do a party buy-in Medicare enrollment. So if somebody is within that 7-month IEP, it is advisable to go to Social Security and just say, I want to enroll to Medicare using my IEP, and not even bringing up the fact that they're eligible for the party buy-in, because that's just going to confuse Social Security. It might not turn out correctly. They may even be like, have pushback and be sent away because they don't know how to do it or they've never heard of the policy before.
I see. So it's not that it changes who you go first. It's just that because it's the initial,
right,
it should be okay with.
Exactly. Oh, okay. Another question, would IEP disenrollment be for?
I think he meant enrollment.
Okay, yeah. Would IEP enrollment be for Part B only, then the ODSS to get Quimby, and then Part A? Yeah, I mean, that's a good question. So if somebody is within their 7-month IEP, they could go to Social Security and request to enroll into Medicare Part A and Part B. Since they may not be eligible for free Part A, they may just request, Part B enrollment and say, I don't want Part A at this time. So that's fine to do within their IEP. And then once they go to apply for the MSP, Quimby will auto-enroll them into Part A if they don't have Part A, and they just have Part B. So that could be another option. And that's if the person really doesn't want to worry about being billed for Part A. Because if you do the Part A enrollment during the IEP, it's not a conditional basis. It's a Part A regular enrollment during the IEP. So that means the person will be hit with Part A bills and the Part B bills. We're just hoping that when they do that and they apply for the MSP is going to be processed soon enough that those bills are not going to turn into a termination of Medicare eventually. So yeah, that could be something that they could do. They could just enroll into Part B, then apply for Quimby, and then Quimby gets them into Part A, and then pays their Part A and their Part B premiums going forward. I hope that answered the question. Okay, moving on. Oh, I'm 43 already. Okay. So individuals should delay paying the premiums, and that's because, again, most of these individuals are low income, so they may not have the finances to pay the premium. Also, we do want to advise them that Quimby will eventually pay the premium, so they really shouldn't worry about paying the premiums. What they should be aware, though, is that there is a 90-day grace period before Medicare terminates somebody's Medicare entitlement for non-payment of premiums. And we also know that there's a 45-day processing time for Medicare Savings Program applications. So we're hoping that that 45-day processing time for MSP applications is quick enough before the 90-day grace period becomes an issue and the person faces disenrollment from Medicare because they haven't paid their premiums. If they did, if Social Security did conditional Part A correctly, then conditional Part A should not generate any bills, any premium bills for Part A. Again, they will see the Part B premiums, but conditional Part A shouldn't be billed to the client. Sometimes Social Security doesn't really know how to code it correctly, so a person, even though they request conditional Part A, may also start seeing bills for Part A and Part B. They should just be aware that there's a 90-day grace period before Medicare even thinks about terminating their Medicare, and there's a 45-day processing time for MSP, so that should give them ample time to get the MSP, get on Quimby before the 90-day grace period expires. So, and then if you think that once somebody's approved for Quimby that, that's the end of the road and everything's peachy, there's still some issues when somebody actually gets approved for Quimby. What has been a very common issue, what we've seen many times, is that so if somebody does do conditional Part A, gets some entitlement from Social Security, applies for the Medicare Savings Program through their RDSS, gets approved for Quimby, what we've seen many times is that for some reason the ODSS did not correctly turn on payments on eMedNI for the Part A premium. I think it's a very common and very straightforward process to turn on Part B premium payments on eMedNI. So we've never seen an issue with Part B premiums being paid when somebody has been approved for Quimby, but we have always seen an issue when the Quimby is also supposed to pay the Part A premium. So somebody who has Quimby may start seeing their Part B premiums paid for, but may still be getting billed for the Part A. And this is just an issue at the ODSS who didn't correctly code on eMedNI for the state to start paying the Part A premiums. It should be a quick fix. We see a dozen of these cases on a monthly basis at the Medicare Rights Center. We just let HRA know of the cases, and they usually just fix it rather quickly. A person themselves could fix it by going to their ODSS, bringing with them their Quimby award notice, and bringing with them, the bills for the Part A that they're still getting from Medicare, and saying that, I have Quimby, but I'm still getting billed for Part A, so, please fix that issue. And that should be a straightforward fix. And if it's not, we always would like to know about any issues like that.
Can I ask a quick question?
Sure.
So in this case, somebody would go to the LDSS to get the Part A buy-in?
Right, because this is for people who already have gone through the entire process and have been approved for Quimby.
Okay.
But even at that point, there still may be an issue where Quimby is not paying Part A, it's just paying Part B. Yeah, so the ODSS is supposed to fix that.
And you said HRA can fix it without client having to go there.
Yeah, HRA should be able to fix it. Like, we're advocates. If we have contests within HRA, yeah, just letting them know that this person has.
Always the case that, they don't turn on Part A.
Part A, yeah, I've seen that many times. It's more complex to do the Part A buy-in on eMedNI, so I think that's why it's a very common issue at the RDSS. So if you do come across somebody who doesn't have that work history to collect Social Security benefits and also therefore doesn't have the work history for free Part A, they should also know of other options. So obviously their option, if they're QIMBY eligible, is to do the Part A buy-in, get conditional Part A, then apply for the MSP, and if they're QIMBY eligible, QIMBY can pay the Part A and the Part B premiums. But how about if somebody is not QIMBY eligible? They do have an option. Usually speaking, when somebody is eligible for Medicare, they're no longer eligible for QHPs in the marketplace. But there's one federal exception to that rule. If a person is now eligible to collect free Part A, meaning they don't have the work history, they have the option of either going with Medicare, or if they don't want Medicare, they can enroll themselves into a QHP through the marketplace. And if they're eligible for premium tax credits, they could also get that to help pay their QHP premiums. So they do have that option, and it's up to the beneficiary to see which option they like better. And again, this is for folks who may not be eligible for QIMBY, because if they're eligible for QIMBY, well, I mean, the logical answer for them is to do the Part A buy-in so that QIMBY pays the Part A and the Part B premium. So as mentioned, Social Security office may be unfamiliar with or unaware of the Part A buy-in process, so we always advise individuals to bring printouts of the POM citations. This is the manual. A person may also run into problems if they're trying to do the Part A buy-in during the general enrollment period. And as many of you may know, the general enrollment period is the formal period where somebody can enroll into Medicare if they miss their IEP. And it runs every year from January 1st to March 31st. If somebody enrolls into Medicare during their GEP, because they missed their IEP, so they didn't enroll when they first should have, there's a consequence to pay for that. So if they enroll during their GEP, their Medicare doesn't begin until July 1st of that same year. So they have to wait all those months before the Medicare becomes effective. If somebody is trying to do the Part A buy-in process during the time frame of the GEP, so from January, February, March, somebody goes into Social Security office and requests to do a Part A buy-in, which could be done at any time of the year, Social Security sometimes may misinterpret that or misunderstand that and process a GEP enrollment rather than a Part A buy-in enrollment. So the person may leave that office with a GEP enrollment and a Medicare effective date of July 1st. And again, this is if they do this, if they try to do a Part A buy-in during the GEP schedule, which is January through March of every year. So it's just something to keep in mind if you're advising somebody about the Part A buy-in, but it's January, it's February, or it's March of that year. Just make them aware that, Social Security may do this error. Just make them aware that they should ensure when their Medicare effective date is. If they see a Medicare effective date of July 1st, then we know that Social Security mistakenly did a GEP enrollment rather than a Part A buy-in enrollment. Okay, some case studies. Any questions before we move on to case studies? Okay, so James lives in Dutchess County and currently has SSI and Medicaid. He is 67 years old and recently learned that Medicare should be his primary insurance. He never enrolled into Medicare when he turned 65. He has a monthly income of about $750 entirely from SSI. How should he go about getting enrolled in Part A and Part B? Anybody? All right, I'll answer it. So James should start by visiting his local Social Security office and requesting enrollment in Medicare. He should inform the staff there that he receives SSI, he's a supplemental security income beneficiary, and he's over the age of 65. He should bring printouts of the POM citations explaining the public welfare accretion, and again, this is because he's on SSI. So once he receives a receipt from Social Security of Medicare application, James should await notice from Social Security that he was enrolled in Medicare. Following Medicare enrollment, he should also receive QIMBY automatically and have his Medicare premiums paid for and retain his Medicare enrollment. So all James really had to do visit Social Security office. So all he has to do is make one visit, one stop, let Social Security office know that he's an SSI, is over 65, but was never enrolled into Medicare. He should bring the POMs just in case. Once Social Security processes his Medicare enrollment, they should also process his QIMBY enrollment. He should be with Medicare and QIMBY in a few weeks, and he should get confirmation letters of both. And again, this is because James is an SSI recipient. Case study number 2. Frank lives in Saratoga County. He is 68 years old and recently learned that he should be enrolled in Medicare. He never enrolled when first eligible because he did not have the required work history for free Part A. He has Medicaid and a monthly income of $1,000 from a part-time job. He does not have SSI. How should he go about getting enrolled in Part A and Part B? So the key term there is that he does not have SSI, so he will have to do the more lengthier process. Frank should visit his local Social Security office, request Medicare enrollment. He should tell the SSA staff that he has Medicaid. He should bring printouts of the POM citations explaining the Part A buying process and request enrollment into conditional Part A and Medicare Part B. After he receives a receipt from Social Security, he can visit the Saratoga County LDSS and request to apply for MSP, specifically QIMBY level. He should receive QIMBY and have his Medicare Part A and Part B premiums paid for and retain his Medicaid enrollment. So for Frank, since he's not SSI, his process is a little bit more lengthier. He had to first stop at Social Security to obtain conditional Part A and that Medicare entitlement. And then once he has that, then he has to go to his LDSS to apply for the MSP. So it's a little bit more drawn out for non-SSI folks.
Gio,
Yes.
because of so many complaints about Social Security not knowing the Part A buying process, has there been like any outreach to like the regional office to say like put out this, you know, Medicaid gives updates to their staff or the ABM?
Yes.
Any of that ever happened?
Well, the Part A, the POM citation that I keep referring to, the manual system, has the Part A buying section. And before, just recently, it wasn't the best. And even if you gave a Social Security representative that section to read through, they sometimes were still confused. So Social Security actually just updated that section of the POM citation, which we like a lot better. It provides case examples to Social Security representatives, how it should be processed. And that was just like 3 months ago when that was updated, because of our collective feedback. So we're hoping that the updated POMs is going to streamline the Part A buying a little bit more. We also did get confirmation from Social Security. We asked them, how do you update the field offices across the state about the update that the POMs receive? It's like, oh, we send out daily emails and they just read through it. Like, and I'm like imagining how many emails must Social Security field office representatives get, and like, are they really going to read through every email and every update? So that's how they get aware of the updates, but still, it's there. So it's better, much better than it was in the past. So we're happy about that.
How long does this process take? Like going to Social Security, applying for the conditional and Part B, and then going to LDSS?
I think usually it'll take a total of 2 months, and that's usually because the MSP end is a lot longer. A person could do the Part A buying in 1 day, go to Social Security, get the confirmation letter that they did the Part A buying, and then after that, they have to go to the ODSS, and because the ODSS has 45 days to process the application for MSP, that's what takes a little longer. So usually we see about 2 months, yeah. So case study, the final case study, number 3. Lisa lives in Erie County and just delayed Part A enrollment because she would have to pay $422 a month for the premium. She kept her Part B and has an income of $800 monthly. She recently learned that she's eligible to have Part A and Part B premiums paid for by New York State. What should Lisa do? So the key word here, the key term here is that she delayed Part A but kept Part B. She has Part B. So that means that she has Medicare entitlement. The hard part is done. Really, the Part A buy-in, the core of it is to get somebody Medicare entitlement so that they can eventually apply for the MSP, because you can't apply for the MSP without Medicare entitlement. This person has Part B, so they have Medicare entitlement already. So all that person has to do is now apply for the MSP. They don't have to go to Social Security. They have Part B. Just go to their ODSS, apply for the MSP, and once they get screened for QIMBY, if they're approved for it, QIMBY will automatically enroll that person into Part A that's missing, and then going forward, it's going to pay their Part A and the Part B premiums. So if they already have Medicare, all we advise them to do is apply for the MSP. All right, any questions? I know it's a lot.
Well, in her example, the 800, sorry, I'm more technical.
Yeah.
The 800 is less than Medicaid.
Right. The 800 is less than Medicaid.
So if she wanted, she could also apply.
Apply for Medicaid, yeah, exactly.
Are there any cons for someone who, despite the Medicare buy-in being there and they're within the Medicaid, why would they also opt potentially for Medicare versus just being able to stay on Medicaid?
If somebody had Medicaid, why would they opt to do the Part A buy-in?
Right.
Well, I mean, that's given the Medicare requirement that they have to go through.
Yeah.
So that's the new requirement, but I was under the impression that if they go to the field office and they just say, I just need a letter that shows that I applied, and they get that letter, potentially they could just stay potentially just with Medicaid, or that's just not the case?
Well, I mean, the ADM does say that the LDSS needs proof of application. So if they have proof of application, that should be sufficient to meet the requirement in order for them to be reevaluated or evaluated for Medicaid. But I mean, it does benefit the person at the end of the day to go through with the entire process, so they have both Medicare and Medicaid working for that person, and QIMBY just pays their Medicare, so they don't have to worry about the premiums, and then they have Medicaid as secondary payer. But yeah, if they just have the proof of application, that should meet the requirement for Medicaid. Should. That's a should.
We've already spoken to 4 DSS offices at this point and have many more to talk to, and their cluelessness about this whole thing is incredible.
Wow.
I mean, they're like the list that we received with 1,900 people on, their lists are blank.
Yeah.
They're blank. So far, we've talked before. They were shocked that we had people on our list that fall into this category and that need this proof. So there's a enormous disconnect with this new ADM and.
Yeah, I mean, I definitely threw everybody out of the it caught everybody by surprise.
Yeah.
Now the fact that individuals who have been on Medicaid for years have never had to worry about the Medicare requirement. They have to jump through hoops to keep their Medicaid. Yeah.
And I like these smaller ones. I don't think they're just enrolling people. Like there's 20, some of these smaller counties like we talked to, there's like 20 people on the list. They still have Medicaid.
They still have Medicaid?
Because the list that the DSS is getting blank.
Exactly.
So who is the DSS reaching out to? Like who are they, giving like discontinuance notices to? You know what I mean? Like if there's nobody on their list, what are they doing? Right. So as we now have this list and start reaching out to people, I think it's going to be surprising to the DSS some of the names and some of the people.
That's crazy, man. How?
Yeah.
I thought that the state was providing those names to the LDSS.
Well, they're providing a list.
A list.
It may or may not have anything on it, or one person or 2 people.
That's nuts. Oh my gosh.
Like one county, when I told them we had a list of 20 some odd people from their county, they were in shock. Oh my God. They were like, how? How do you have that? Of course, then they wanted the list that we had, but.
Oh gosh. Yeah. And then at Social Security, and they're not making it any easier. I mean, the Part A buy-in, POMS was updated, but we're still hearing a lot of issues when people go to Social Security
Yeah.
about them not knowing what this.
Yeah, and the one we spoke to so far,
They didn't know about it.
they didn't know, I mean, they didn't know about this, but they were receptive.
Okay.
I mean, they were,
I don't think they knew about conditional Part A, though. That's kind of the vibe
Yeah.
I got. They were like, if
Yeah.
they're outside the GEP, they're not.
Yeah, that's usually what we, I mean,
That's
yeah,
exactly what
I've had experiences with that is the answer. They're outside the GEP, come back in January.
that's
Yeah.
exactly what they said.
Yeah. Well, I mean, yeah, we did have another case too recently where the updated POMS was very handy because it was a case that we've been working on with Social Security. We provided them the old POMS, and it just wasn't registering with them. But then the new POMS was updated, and they were like, no, see here are the case examples.
Yeah.
Here's the consumer-friendly lingo as well. So they were able to process it with the updates. So hopefully, if you just show them the updated POMS, I think they'll be very much more receptive to following.
Yeah.
Yeah.
Hopefully.
Hopefully.
Yeah.
Let me see if there's any last questions. Okay, so Greg.
It might actually be more.
Yeah. Yeah, I suspect that several folks have advised about party buy-in, don't have the wherewithal to follow through with the process. We recommend they have someone assist them when needed. So as a practical matter, how do you advise people who just can't be organized enough to do all these steps and perhaps have no one to help them? We have research for this, but I wonder how. Well, we did develop our own flyer, Greg, the party buy-in flyer, which it does have in consumer-friendly lingo the steps that a person could follow, and also a draft letter that they could hand in to Social Security and really not even have to say anything, because that draft letter that we developed explains why they're there, explains to Social Security the policy, explains everything that Social Security needs to know. So we've had some success with our draft letter and our flyer, and the person just handing that to Social Security and really not having to say anything. But other than that, I mean, if there's any organizations that do provide assistance with on-site assistance to help somebody do it, yeah.
We are, CSS, we're doing this as part of our FE ABD program. Unfortunately for you, Greg, we are the only, our coverage area is upstate. And so we don't have any subcontractors or local agencies that are providing this. The lead agency here in New York City is Public Health Solutions. So they're the ones in the FE ABD program who are providing that assistance. But anybody upstate, we can refer them to the FE ABD program now to help with this process.
I think there's something over here. So I thought I had put the link in where I had mentioned the POMS in one of the slides, and there's a hyperlink there. So that should take you to the new POMS, the updated POMS citation. If not, I could just email Carolina the link, and then she'll share it with everybody.
I can get it too. I can forward it to them.
Okay, perfect. Understood. The Public Health Solutions doesn't do.
Doesn't do what?
They're not,
It's being recorded. We'll follow up.
Okay, we'll follow up. Well, I think that was all. Medicare Rights Center, we're always here. So any questions? You know where to find us.
Thank you so much.
No problem.
Thank you.
All right, folks. Thank you for joining us again for the August monthly meeting.
We had a question about our due date.
We had a question about the intensive training, annual training that we've had at Binghamton. We will update you on that as we confirm on our end. So far, it looks like it might be the first week of October. And so far, it is looking as if it might be in Binghamton. But it might be the 4th and 5th of October.
Yes.
So you can take those dates down for now. If anything changes, and as we confirm we'll keep you posted. Remember, Patrick and Charity are out next week. If you need immediate assistance, you can call Adri or myself. Anyone with issues, with any Salesforce issues, please reach out. And everyone, please make sure that everyone has watched the two Medicare trainings, the one for the agencies and the one for the lead agency. And I think that sums it up. We will stay online for 2 more minutes, even though we're over time, in case anyone thinks of any other questions. Nice talking to you all again. Talk to you soon.